Sunday, thousands of people will gather in Central Park for the annual Making Strides Against Breast Cancer Walk, which will help more than 250,000 men and women who will be diagnosed this year.
Yeah, this weekend's event is the largest breast cancer event in the country, and there will be plenty of survivors there, including our next guest, Clara Sharp. And she's joined by Dr. Paul Barron, the director of the breast cancer program at Lenox Hill Hospital. Good morning, Clara and Dr. Barron.
Good morning.
Yeah, thanks for being with us.
Thanks for having us.
Yeah, so first, Clara, let's begin with you. Can you talk a little bit about your breast cancer journey? When were you diagnosed? What stage you were at when it was discovered?
Sure. I was diagnosed in February of 2021, and I was actually 4 months postpartum. I had a baby, and I was breastfeeding, and I felt a lump while breastfeeding, and immediately felt that it was maybe not a normal lump that comes with breastfeeding, and sought out help with a physician, and it was in fact breast cancer, and it was stage 2.
Oh, wow. And you know, you had to really advocate for yourself with the doctors, right? So kind of walk us through what that process was like.
Yeah, sure. I think because I was diagnosed at a young age, I was 37, and I was breastfeeding, it's highly unlikely that this would actually be a breast cancer. So every time I called my OB's office, which is who you would call your GYN when you find a lump in your breast, they kept telling me this is from breastfeeding. And it took 3 phone calls on my part, and really advocating for myself for them to send me for a mammogram.
Yeah, thankfully you didn't just settle on that first diagnosis, right? Dr. Barron, is Clara's situation unique at all?
Well, it's relatively uncommon, certainly a young patient. We definitely see breast cancer in 30-year-olds. We definitely see people who are pregnant or just given birth with breast cancer. So again, not terribly common, but it absolutely happens. And it just goes with the standard recommendation. If you feel a lump and it's new, you need to show it to your doctor and hopefully get worked up in an expeditious fashion.
You know, doctor, sometimes male breast cancer is not talked about because it's so rare, right? But each year more than 500 men die from the disease. So what's your advice for men out there? How do they detect it?
Yeah, it's still relatively uncommon. It's about 2,500 breast cancers a year in men. And so it's less than 1% of all cancers. So we still don't screen for male breast cancer. So with men, if they find a new lump, it's the same sort of rules. You find a new lump, especially if it's on one side versus the other, then you should show it to your doctor. It's not uncommon for men to get what's called gynecomastia, which is kind of swelling of both breasts, and that turns out to be okay. And as far as the cure rate, it's basically exactly the same as women with breast cancer. We treat it the same, whether it be surgery, in some cases chemotherapy, commonly anti-estrogen therapy. But we do, as long as the patients show up in a relatively early fashion, we have the same success rate.
Yeah, thankfully, Clara, you went in there and were determined to figure out what this was and didn't take that first answer. But when you go to see the doctor, is there something that people should do to really prepare themselves when they go there to make sure that they get the proper treatment?
Yeah, I mean, I think that it's important to always have your questions written down, because once you go into that appointment, it's easy to kind of lose focus and lose track. But have your questions written down. I found it really helpful to bring a family member with me, because you can't remember everything. Yes, absolutely. And I really feel very strongly that you should not be afraid to see multiple doctors to find the person that you're comfortable with.
That's such an important point right there. And Dr. Barron, you know, I've had breast cancer in the family, some dear friends, in addition to chemotherapy, right? And some women say, I don't want the chemotherapy. What are the other options or alternatives are there to keep them healthy and alive?
Sure. Well, it depends on the type of cancer patients have. If the tumor is what's called estrogen receptor positive, then they usually don't need chemotherapy. They can just get by with anti-estrogen therapy. There's certain types of cancers that's what's called triple negative cancers or HER2 positive cancers where they usually do need chemotherapy. And because we have really great success with it. The tumors melt away if we give it prior to surgery, or the survival is definitely improved, we give it after surgery. So you actually have to balance things. I want to reiterate something Clara just mentioned, and that's the bringing along a friend or a loved one to have a second set of ears there, because we do give them a lot of information, and sometimes it's overwhelming, and you only hear some of it.
And Clara, we're so happy to report that you are cancer-free, right?
Yes.
It's really changed your life, hasn't it?
Oh yeah, certainly. I mean, it's little bit calmer right now. And I'm still wrapping my head around the fact that I went through this last year. I'm taking the time to really enjoy time with my husband, my 2 daughters, and because I have 2 daughters, I feel very passionately about making sure that we are funding research, because research is the reason I'm still alive today.
Absolutely, and we're glad you are. Thank you for being here to share your story, Doctor. Thank you. And there is still time to register for this Sunday's Making Strides Against Breast Cancer walk. So grab your walking shoes, everybody. Head on over to Central Park. It all begins this Sunday at 8 a.m.
Clara, Dr. Barron, thanks again for being with us.